A very, very warm welcome to all our participants. It's wonderful to have all of you on board. We have very strong attendance. It is so good to see such strong interest sustained over 3 days. So to all of you, well done. It reflects, of course, on the quality, the top quality of the training by Professor Neil Lobo, conveyed in such a easily digestible and likable way. I think we're all learning a great deal. So to you, Neil, again, from all of us, a very sincere thank you for setting aside this time to share that knowledge and experience with us. So welcome aboard again, everyone. Great to have you as part of our third and last afternoon of training for this year. We hope to repeat the course next year. I need to go on hands and knees before Neil and ask him if he'll repeat it again next year. But just briefly to say that all three sessions have been and will be recorded and made available on the APMEN and ORIN websites. Wulan will post the URL in the chat box so you can access all the recordings and go through it in your own time or refer friends to see the full recordings. We're going to have a slight change in the flow this afternoon because of requests from various people that the trainings are going on for too long and it impacts the other meetings people have organized. So today we will have a 45-minute session initially, then a 5-minute break before we commence with a second 45-minute session. Then again, we're going to ask if you wouldn't mind doing another 15-minute post-course evaluation so that we can measure the improvement or the difference in score from the survey questionnaire you did on Monday, on day one, on Tuesday, compared with today. Did you actually learn anything? We want to try and measure the improvement. And then after that 15-minute questionnaire survey, we'll go to the questions and answer session. Again, to confirm, if we don't get to all the questions in that 20-minute Q&A session, the questions will all be responded to by our expert, Professor Neil Lobo, in the next week or so, and the responses will be sent out back to everyone. So don't worry, if we don't get to it now, we will get to it. Also, just to confirm again, unfortunately, because of the sheer numbers of people participating, we cannot allow audio to everyone. So, please, if you stick up your hand, we can't. There are just too many people that would like to ask questions. So if you do have questions, please put them in the Q&A box, not the chat box. There are just too many people present. So, we can't monitor both the chat box and the Q&A box for questions. So we're only going to look for questions in the Q&A box. That's the place to put your questions. My last point, sorry, we're going to start now. My last point is about the certificates of attendance. Remember on day one and day two, yesterday and the day before, we said that everybody who attended all 3 days and you attended at least 75% of each day, the system will automatically send you with your name on the certificate of attendance Each of you that qualify for that certificate, you will be receiving a certificate of attendance, but you must have attended all 3 days for at least 75%. So thank you again, everyone. Congratulations on your uh, sustained interest and patience. Neil, over to you.
Good morning, good afternoon, good evening, into the presentations. I will share my screen now. I hope you can see this. So today we are going to do three presentations. The first one is on managing entomological data. And this is super important because if you spend all this time and energy and our very limited resources on collecting the data, we want to make sure we can actually utilize it, right? And so this is a short presentation on managing entomological data. And then I will go through example questions, actual example questions that were implemented to demonstrate the thinking process and how important the outcomes can be, whether they were positive or negative. Okay, next slide. So where are we in the ESPT? And this is, you've gone through the whole system. You've gone through everything here. And so now we want to understand how to properly manage our data, how to enter our data, clean and store our data. I know you are probably really good at this and have already done this, but it's important to go through it again. And just an example later on, even before we start, there are three things we should do. The first thing is to identify the required data collection forms. And this is so that we can standardize all the data points, the specific data points we want to collect. If we just go out to the field with a pad and a pen and just write things down, it's absolutely not going to work. The data you collect at one site, the data someone collects at another site will not be standardized, and you cannot compare the data sets, right? So I'll go through these. The second step is to adapt these forms once you have these data forms for your specific needs, and also to establish data dictionaries. And I'll go through each one of these steps. So every activity, whether it's in lab or field, we need a standardized data collection form. For example, when you're doing WHO bioassays, there's a specific form you have to fill out. And that ensures that the data you collect adheres to like global guidelines, that everyone will trust your data, everyone will believe your data, and that it's standardized, right? And so that your data quality is good, basically. And here's an example of a data form. Now, what I do is before I start my study, before I start anything, I make a list of activities, and with each activity, I develop a data form so that that data form can be used for that activity in every single site every time we go to the field, so the data collected is as good as possible. The second part is all these data forms, you do not have to develop them from scratch because they've been used before. For example, HLC forms, people have developed them, people are using them. So there are lots of templates available. People with lots of experience have developed them, and you can email them, ask for them, email me, ask me, like, do you have a form on how to collect HLCs or how to collect human behavior observations? People have them. The key point is that once you get the form, right, you look at it and adapt it for your specific needs because your needs might be slightly different. For example, if we just look at human behavior observation forms, there's an example template in the ESPT, and this is it. For example, we're trying to collect human behavior. So we just quickly go over this form and see how to adapt it. So let's say you get this form and you say, we have to put in our locality, district, region. But maybe in my area, in my country, don't say region, we say village. So we have to change that, right? It might not be district, it might be province. You might want to put in your supervisor name, all these things. That it might be house code. There might be different data points you want to collect with regards to the house. Now let's say we look at the data collection. hour of observation from 6 p.m. to 7 p.m. Maybe we want to start at 5 p.m. So you want to adapt that. Now we're looking at inside and outside data collection, as in when we're looking at location of observation. Perhaps we're trying to do this in a forested site, so we might want to add forest. Now we're looking at the number of people at the end of the collection hour, if they're using a bed net, not using a bed net, if they're sleeping or awake, you might want to do location if they're inside or outside as well. Or you might want to, ooh, excuse me, I'm going to sneeze. And this is going to be recorded. Okay, my sneeze went away. Uh, what was I saying? Oh, yes. So we might want to adapt this data form based on our specific needs. Maybe this is for a man or a woman or a specific age. So once you get these templates, you don't have to spend too much effort in developing it because they're already developed. Now you can adapt it for your specific needs. And here, I forgot about these animations, and I will blame my sneeze that never appeared. Now, once you have your form, all the data from your form will be imported in a standardized way into a data uh, on your computer, right? Into a data form on your computer. So now you want to make sure you have a data dictionary. Now, a data dictionary explains everything about your data. If you imagine an Excel sheet, and we'll actually have an example on the next slide, the column header, let's say it says duration of rainfall, you might call it just rainfall. I might call it duration of rainfall. Someone else might call it the amount of rainfall. Someone else might call it just rainfall. So we want to define what that is because different people might define it differently. When defines it differently, we have to make sure that we actually understand it, right? So we have a data dictionary that standardizes everything and explains everything. And an example is in the 1960s and 70s, there was a really good study that looked at mosquito species and interventions. However, in that study, they coded the mosquito species by 1, 2, 3, 4. I think it was up to 10, 11 or 10, 11. So they had 9, 10, or 11 species of mosquitoes there. But whoever did that data, collected that data, did not write what each species was. Was species 1 Anopheles gambiae? Was it Anopheles arabiensis or fenestus? They did not write it down. And I have no idea what species 1 is, species 2 is. And if they wrote that down, if they had that data dictionary, that data would be so useful. In my lab, if someone sends me data without a dictionary, I send it back because I don't understand it. And the key point is if you have spent all this time collecting data, and you're going to be sharing it, which I hope you do, you don't want the person you share it with to email you 200 times asking you, what does this mean? What does that mean? There's a blank cell. What does that mean? Right? You've already done all this work. You don't need more work to do. So what I would do is give him or her all the information they need to understand the data in the form of a data dictionary so they don't bother you anymore, so that they do not need you to understand the data. And that is a key point of data standardization and data clarity. Give everyone a data set that they can completely understand it themselves. Here's an example of a data dictionary. You can see this is just an example of a data set. You can see the column headers. And if you look at this, what does it mean? Like you might not know what it means. So to make a data dictionary, you just take the column headers, right? And just put them, for example, there's the column header. And you just take each column header and explain what it is, right? So for example, this SR number is the serial number, right? Morphological identification means morphological identification. And you can see right here, I've made a spelling mistake, which I shouldn't do. The collection method, which is right here, is a different collection method. And here on the right, you can see LT means light trap, PSC means pyrethroid spray sheet collection, and HLO is human landing catches outdoors, right? So you can have codes for every single option you have. So when I get this data set, I understand it completely. Another thing to do is here. So we have different languages across the planet. And what I do is, for example, if I'm working in a French-speaking country, I will duplicate the data dictionary in English and in the local language. So when I share it with someone who's French-speaking, they can understand the data dictionary. I hope that made sense. So you're looking at comprehension of your data sets across languages and across people. So once you have your standardized data forms and your data dictionaries, it's then data management, right? It's data entry and cleaning and data storage. So all field and lab data, which is usually collected in paper, even now, though now people are collecting it digitally on tablets and on phones, right? All of it has to be entered into a database. And during database entry, we want to make sure that we have clean data, that we fix all the errors, we fix empty fields, and we fix formatting issues. Uh, an easy thing is when we're entering data, sometimes if there are no mosquitoes, we leave it blank. We leave that little data form, the little cell on the data form, we leave it blank because it's easier to just leave it blank than to put a zero. But if I have not been in the field, I do not know if that blank cell means the data was not collected or the data was zero, right? So it is really important to fill every cell with something so that you understand it. And here's an example of a data form and for quality check. Now, I'd like you to look through this quickly to try and find mistakes. And it looks like a data form, and if you just glance at it, it looks, yep, this looks good. But if you look at it in detail, there are several aspects about this data form that need to be cleaned and need to be fixed. For example, there's a mistake in the time here, 23:02, right? The collection hour is 22 hours to 23 hours, but the start time is 23:02, which is the next hour. So that needs to be fixed. Here we have, was it raining? Yes or no? Is it Y and N? It can't be both. It was either raining or it wasn't, right? Here's an empty cell. I do not know if the data was collected, if it wasn't collected, or what percentage RH was at that point in time. And here's another example, temperature. It was 300 degrees out there. I don't think we would have collected any mosquitoes if it was 300. Well, I wouldn't have been out there. I would have tried to find an air-conditioned room. So you can see just in this single data form, there are a bunch of mistakes that we need to clean up before any analysis. Uh, Data storage. So every country, every institute has its institutional review board, and this approves what is allowed and what is not allowed in your data collection, data storage, data sharing. This is really important to adhere to, really important to follow what your IRB says. And this is because we are sometimes collecting data about individuals. For example, if you're collecting data on mosquitoes in my house, you're going to have the GPS of my house. You're going to have my name. You're going to have the number of kids. You're going to have all these details about my house and where I live. Now, here's a question. Think about if it was your house. Would you like that data to be shared across the world? Do you want the rest of the world to know where you live, how many kids you have, how many daughters you have? The answer is no. And based on institutional review boards, these boards protect individual data, the data of you, the data of the people who are collecting data from. And since we are collecting all this data to protect people, perhaps from disease, but we also want to protect their own individual personal data. So now there are three sort of kinds of data here. The raw data that we collect that has all the data that we collect. Then we clean the data and take out mistakes and everything. This is the second set of data. And then the third set of data is de-identified data, where we take out personal information. For example, you might take out a person's age, or you might take out a person's name from that data set. So we cannot individually identify the person in that data. So usually there are three sets of data from each data collection, the raw data, then you clean it, and then you perhaps de-identify it based on your country rules and regulations. And what can be shared is also really important, right? A lot of the times you can only share de-identified data, data without human personal information. So follow the rules and regulations of your country because we need to protect other people just as we would want our data to be protected. For my data, I mean. An important part is to keep historical entomological data because this allows for the accumulation and storage of knowledge. I never delete old data. I may delete the raw data after some time, though ideally you would save it, but definitely keep the de-identified data because that is a source of knowledge and a source of data that we can use at some point in time. That is my short presentation on data and how to maintain data quality and storage and use. I do have my next presentation, which I'm going to show you the the title slide, and but then I'm not going to present it. And this is because we want to save time. But I would recommend you look at it. Uh, so this slide set is how to visualize and present your data. And this is something I have found really important. I'll spend 2 minutes on it because, all us entomologists, all us ento geeks, we love what we do, right? We're out in the field spending all this effort and time in collecting our data. And then we want to present our data to, let's say, our bosses or other people. And we want them to understand the effort we've put in, everything we've done to actually get this data and the analysis. And the truth is, a lot of the time, the people who are listening to us do not care, right? They come from their own perspective and they want to hear. I will look at this little cartoon on the right. This is what we want to say on the left, and this is what they're interested in. We need to focus our presentations on what is relevant to them, right? A lot of it is tailoring our presentation to our audience. Like, what does our audience need to hear? What do they actually understand? For example, if I'm presenting to a doctor in the Ministry of Health, they do not care about my HLC SOP. Right? They want to know how our data impacts their decisions. So I would focus my data, my presentations on the data they need to hear. And this is effective communication of everything we know to our target audience. How do we get them to understand based on their background? We look at it from their perspective, but not from our perspective. And in this manner, we can actually get them to understand and get them to make decisions better. So there is the summary slide is to know your audience. The data should be relevant. We need to keep it simple. We need to design our presentations for readability, for understanding. And it's really cool when you tell a story, right? No one wants to just listen to data after data slide after data slide. How do you make it relevant to them? So this is a presentation that will be given to you, and I hope you look through it towards understanding how to make better presentations and how to deliver our data sets and our knowledge to other people. My next two slide sets are of two examples that were, at least to me, they were super cool. Here is where we were implementing the ESPT, implementing everything that we went through in the last 2 days. We actually implemented it. And this is starting off with a question. So this was in Panama, the country of Panama. So just brief background, there were outbreaks in Panama. Malaria wasn't that high, but there were outbreaks in Panama from 2001 to 2004. In 2016, there were no deaths, but almost 1,000 cases, under 1,000 cases. In 2019, cases went up. And all these cases were in really remote areas with indigenous populations that were hard to reach. And these indigenous populations were also very resistant to Ministry of Health interventions. And uh, so just like in many areas, they resisted outside influence. And 90% of these cases were in these areas. And as a note, the Guna people, the people who lived in those areas, the indigenous people, had these, you can see a picture of this lady's leg. They had these beautiful beadwork that, this is a tangent, extra stuff. They had these beautiful beadwork on their legs that they wore all the time. It was quite nice. So this is Panama, the country of Panama. And all the way on the right, you can see where we actually did the study, where the red arrow is, and all the pink dot spots are all the little remote areas with remaining residual malaria. And our objective, before I get to our objective, the background to what was actually happening at the site, IRS. So the Ministry of Health actually implemented IRS with phenitrathione, and they were implementing it for about 20 years, phenitrathione, and no insecticide resistance was demonstrated. Larviciding was implemented, but they had no idea how useful it was. ITNs were not distributed by the Ministry of Health because the primary intervention was IRS. And the belief was that because the mosquitoes were all outdoor biting, that bed nets would not be that useful because most of the mosquitoes were biting outdoors. But ITNs, our bed nets, were available in the markets. So now the Ministry of Health wanted to know, their question was, we still have this residual malaria. Are ITNs an effective vector control tool? Remember, we start with a question, and this is our question. And I know you remember this slide. How do ITNs work? How do they not work? So we wanted to answer this question by answering these sub-questions. Bed nets work on late-night indoor-biting mosquitoes. We wanted to measure the number and the amount of indoor late-night biting. We also wanted to measure the amount of, on the right, the mosquitoes that did not bite indoors and late night. We wanted to look, or where were humans? Were they indoors using bed nets? Were they outside? What time were they sleeping? Remember the HBOs, the human behavior observations? This is exactly what we did. We also wanted to look at insecticide resistance, where mosquitoes resistant to the insecticides or were they susceptible. So we look at how bed nets work and how they did not work. And this was our strategy to answer the question. So on this slide, we have our question, our indicators, the sampling method that would that would collect the indicators. We would then select our sites where we would implement our sampling methods to collect the indicators to answer our question, and then figure out a sampling design at our sampling site that collected our sampling, and so on. So the first question, well, the sub-questions were, what are our vector behaviors? What are our human behaviors? What is the insecticide resistance status? That's pretty simple, right? Because we went over that in this slide. This is the questions we had. And to collect that for our indicators, for the first question is, what are our human biting rate? And what time are they biting? Because this is relevant to bed nets. What are the human behaviors? The indicators we would collect are, where are people? When are they there? Are they awake? Are they asleep? Are they using bed nets or are they not using bed nets? For insecticide resistance status, we would do insecticide resistance tests. Our sampling methods for human biting rate and for the biting time, we would do HLCs inside and outside houses. For temporal location, to understand human behaviors, we would do human behavior observations. And to get insecticide resistance tests, we would do larval surveys plus CDC bottle assays with those larval surveys, with the larvae. We would raise them to adults and do CDC bottle assays. Now, site selection. We were going to be doing a baseline survey because we didn't have any prior data. And the thought was to use 5 key sampling sites, and each site would have different sort of cultural inhabitants because we wanted to capture the different human behaviors. So that's what we wanted to do at 5 sites across the country. The sampling design was to do the collections over 1 year based on the season, and we'd go back 5 times a year. Each time we'd go back to that site, we would do these collections in 5 sentinel houses and do collections for 10 days. So 10-day collections at 5 houses each time, 5 times a year. And then this was our ideal study that we wanted to do, that the Ministry of Health and us decided we would move forward with. Now, the next step was to look at capacity and funding, which of course destroys everything, as you know. So the NMCP discussed internal funding plus $50,000 from our project. And it wouldn't fit. We couldn't afford it. So what did we do? We had to go back to the question to understand exactly what we could afford to do. And this is a very, very real situation, right? So the first thing we realized is that we were also answering other questions about IRS and larval source management. So we thought, let's take out insecticides, right? So when we took out insecticides there, we took out the larval surveys. So that reduced the funding needs. The next step, instead of 5 sites, we could afford 2 sites. Instead of going back 5 times a year, we could afford to go back 3 times a year. We kept the 5 sentinel houses, and instead of 10 days each collection, we had 5 days each collection. So now we kept the main infrastructure, the main framework of our data collection, but we reduced the sampling framework to fit within our capacity and budget, enabling us to still collect good data to answer our question. Now, I'll quickly go over what actually happened. We could afford that. That's the smiley face. So here are the key findings. We had 2 sites, correct? At site 1 is on the left. On the left, you see the human biting rate on the left here on the y-axis. And on the right, you see the hours of the night. Please note that there's 1 to 13. So we collected for 13 hours and not 12 hours because we found out that the mosquitoes started biting at 5 p.m., not 6 p.m. So we had to adapt our data collection form. We had to adapt our data methodologies to be able to encompass what was happening at that site. So we started at 5 p.m. and then ended at 6 a.m. At both sites, site 1 and site 2, it was really interesting. We found similar mosquito behaviors, even though there were less mosquitoes at site 2 in this graph. They were basically similar. There were more mosquitoes outdoors, which is the green line, less indoors, which is the red line, and most of the mosquitoes you can see were biting earlier in the evening. So primary biting is outdoors, primary biting is early evening. And the next step is the human behaviors. So I'm just going to work through this so you can see, because the eventual graph is actually kind of complicated. So if we look at the proportion of people in that community on the left, on the y-axis, and the hour of the night on the x-axis, the green represents people outside awake. You can see earlier in the evening, they're all outside at this site 1. And then over the night, those number goes down because people are going indoors. And you can see here at about 5 a.m., they start waking up. These are people inside awake. You can see people are going inside, so the number increases. And then they start going to sleep, so the number of people awake goes down. This is people inside asleep that do not use bed nets. See, they start going to sleep at about 5, 6, 7 o'clock. These are mainly the kids. Then they sleep throughout the night, and then they start waking up right here. And these are people asleep with bed nets. Right? I hope that makes sense. So overall, you can look at the human behavior. This is at site 1. Now, very interestingly, sorry. All these at each hour and add them up, you get this pie chart. And here's a pie chart. You can see the red is people inside sleep, not under bed nets, which is the red. The people under purple are people using bed nets. So about 23% of people were actually using bed nets they bought at the market. Green is people outside over the night, and blue is people inside awake over the night. Now, this is site 2. It looks kind of the same, but it looks kind of different. And so I have to mention site 1 and site 2 were very close to each other. But if you look at the graph on top and the graph below, you can see key differences. And the key differences is because at site 1, people went to sleep earlier than at site 2. And site 1, people used less bed nets. You can see the difference between the purple line and the red line. And they used more bed nets at site 2. And it's really interesting. Even though the sites were really close, maybe a 5 to 10 minute walk away from each other with the same vector behaviors at both sites, because they had the same vectors, the human behavior differed. And the human behavior differed because at site 2, they had electricity. And when they had electricity, they stayed awake longer. And when it was dark at site 1, when it went dark, they went to sleep earlier. And a simple difference like electricity can completely change not just human behaviors, but it completely changes exposure. And I can show you that on the next slide. So do you remember vector behavior plus human behavior is equal to the adjusted human biting rate based on human behavior? Now, this is exactly what we did with the two data sets I showed you. We took the mosquito data up here, and we took the human data, and we combined them in an analysis that I explained yesterday. And this is what we got. This is for site 1. The green line is the biting rate outdoors based on human behavior and vector behavior. The red line is biting rate indoors based on human behavior and vector behavior. And the blue line is the biting rate on people indoors awake. Wait, no, am I mixing things up? Yes, indoors awake. The red line is when they're asleep without bed nets. I'm getting confused as usual. And you can see the red and the blue are indoor biting, one when they're awake and one when they're awake and one they're asleep. The sleep one is the red and the green is outdoors. Now, if you look at the above figure, the small little one of vector behavior, you can see that the green is outdoor mosquitoes. Most of the mosquitoes were biting outdoors. But based on human behavior, all the exposure was happening indoors, right? The blue and the red, that's all indoors when people are asleep and people are awake. And you can immediately see how the human behavior impacts exposure to malaria. Now, this is at site 1. What do you think happened at site 2? Remember, they went to sleep completely different at different times. Their behaviors were slightly different. They went indoors later on. That was at site 2. When we compare the human behavior and the vector behavior and do an analysis, we find at site 2, most of the exposure is outdoors because they were staying up late. They were staying outside late with electricity. So same mosquito biting profiles, completely different exposure profiles to malaria and at two very close sites. So now if we take both these site 1 and site 2 and we make a pie chart based on the exposure profiles, based on what's happening to the community, we see two different exposure profiles. At site 1, about half of the exposure was happening indoors when they were asleep without bed nets. But at site 2, that same exposure was only about 25%, 20%. Site 1, about 20% of exposure was happening outdoors. Site 2, it was about, what's this, about 70%, 65%? And you can see indoors awake is about 30% at site 1 and much less at site 2. Same mosquitoes, different behavior profiles, completely changes where and when they're being exposed to mosquitoes. So what did we do with this? We actually answered the question, right? Where are bites occurring? And how can we protect these people? So what we did is we take this pie chart and now we look and see what interventions would work in these places and times. At site 1, the red. The red is where people are asleep without bed nets. That's about half of the transmission, half of the exposure. We can increase bed net use. People were buying bed nets in the market, but what would happen if the Ministry of Health distributed bed nets? We could get rid or minimize this red part. With the blue part, when people are awake indoors, you cannot give them bed nets, right? Can we give them spatial repellents or topical repellents? These are options of interventions we can apply to those spaces and times. And outdoors, which is about 20%, we can possibly give them, we can do LSM, larval source management, or possibly topical repellents or spatial repellents if they work outdoors. We can take the same set of interventions and apply them to site 2, right? So we took this and presented this to the Ministry of Health, and we said, here's our data. What do you think you can do? The answer to the question is of will bed nets be useful? The answer is bed nets will be useful based on the site, right? And based on the human behaviors and the vector behaviors. What would you like to do? So the Ministry of Health thought, let's do a pilot study where we implement bed nets, do bed net distribution. Please note that the figure on the left at site 1 is the same one on the left over here. So at March 2019, that was the figure. That was where exposure was happening. The country decided to do a bed net distribution plus SBCC, social behavior change communication. They told people, this is where you're being exposed. If you increase bed net usage, you will be bitten less by bed net. So they educated the community. Community education is so important here. They had the community be part of this, and the community decided we want to protect ourselves better. And in July, August 2019, how many months is that? March, April, May, June, July. 4 or 5 months later, look at the change in exposure. The exposure changed completely. The red diminished hugely. And this, of course, is proportional exposure. And if we look at actual numbers, this is what the actual numbers were. So the same figure over here is on the top left, but the actual numbers, pre and post bednet distribution, bednet plus SBCC, right? You can see pre and post, indoors asleep with bed nets went down hugely because people started using their bed nets, right? And indoors awake, people had SBCC. They were like, if I'm under a bed net, I'm going to be protected. So people were awake, not on their bed nets, less. They actually went under their bed nets even when they were awake because they didn't want to be bitten. And outdoor, they were the same outdoors, so nothing changed. So we actually reduced the exposure profile based on targeted data, and just with $50,000, which is a lot of money, but it's also not a lot of money when we consider protecting people. So the program's question was, going back to the question, right? Our main objective, are bed nets an effective vector control strategy, right? And the answer is bed nets are an appropriate and effective vector control strategy, but it's not sufficient as a sole event intervention to eliminate malaria. And that is because we have already measured and we know that there's exposure happening when people are indoors awake, and we even know how much. And we know there's exposure happening when people are outdoors, and we know how much. But we know how much we could potentially reduce that. And that is so important, right? So the answer is yes, they're appropriate and effective, but not enough to eliminate malaria. We must look at other interventions or other strategies that can be included to remove these gaps in protection, to close these gaps in protection that we have identified and measured. And here's a picture from a newspaper article, from an online article, where the BedNet strategy was considered to be very successful, and the Ministry of Health changed policy. Right, they started distributing BedNets with the indigenous authorities, with the indigenous populations. We need to work with populations and communities. It's so important to do that to get effective vector control, and you can see how targeting gaps in protection, right, can completely have a great impact on malaria. And you can see the woman here, like actually making sure her bed net works. And so the next question, I'll quickly go over this. We had at that same site is IRS an effective vector control tool? On the left side is how IRS works on indoor resting mosquitoes. It does not function on mosquitoes that do not rest on those sprayed walls. And mosquitoes have to be susceptible to the insecticide, right, to be useful. And again, the same sites, same country, same strategy. What are the questions? We want to look at the indoor resting behaviors, we want to look at insecticide resistance status, and we want to look at the impact on exposure, right? Exposure to human beings. So the indicators are indoor resting rate, insecticide resistance, and the human behavior adjusted biting rates. There's IRS impact exposure. So the sampling methods are indoor aspirations, IAs, it's indoor aspirations inside houses, and larval sampling for insecticide resistance, and HLCs and HBOs to look at human behavior adjusted biting rates. We wanted to do it again at 5 key sampling sites with 2 separate cultural inhabitants. And the sampling design was at five time points, 5 sentinel sites, 10 days, just as with bed nets. We, of course, wanted to look at funding and capacity. We realized that insecticide resistance tests were absolutely vital because the country was, if you remember, conducting IRS for the last 20 years with the same chemical, and no insecticide resistance was demonstrated. And they wanted to have an external sort of insecticide resistance validation. So that was required. So this was our initial strategy, and as usual, we could not afford it. So we went through it, and the first thing we realized is, remember when we did the HLCs? Sorry, when we evaluated bed nets, we had already done HLCs plus HBOs. So we thought if we're going to be doing this at the same sites, let's overlap our IRS question at the same site so we can save funds and resources. So again, a properly designed entomological surveillance can answer multiple questions. So we utilized all our BedNet data, all our BedNet investment in trying to understand BedNets with IRS. And we changed our sampling sites. The red ones are what we changed specifically for this study. We had one key sampling site, the same site actually. We changed it instead of 5 to 3. We had 15 sentinel houses. We decided we wanted to do far more houses than just 5, and 5 collection days each time point. And this actually fit our budget. And the data on one slide, right, is here. So our question is IRS an effective tool? Let's go up first. Oh no, let's go down first. Are they susceptible to the insecticide? We conducted larval collections and did CDC bottle assays, and we found out that 26.3% of the mosquitoes survived. That means they were resistant. And this represents a gap in protection. Resistant vectors are resistant to IRS. They are not going to be that impacted. So that's a gap in protection. Now, are the vectors resting behaviors known? So we did PSC. Sorry, we did not do PSCs. We did indo aspirations. That's a mistake, and I have to correct it. And then we also, towards understanding the impact on exposure, we used the data from the bed nets, right? The understanding bed nets, HBOs plus HLCs, and this as an overall understanding. Now, if we look at the HLC, just look at this little table here. From the HLC rates, we could see that 7.8 mosquitoes were coming inside to feed on a person every night. And outdoors, it was 30.5. If you remember the bed net question, this is the data from that. So a total of about 8 mosquitoes were coming indoors and 30 mosquitoes were coming outdoors to each house per person. But when we looked at indoor resting, there were 0 mosquitoes resting indoors. So if we add 30 plus 8, so about 38 mosquitoes were approaching a house, and 0 were going inside and resting on the house, inside the house. They might have been going inside, but were not resting. And if they were not resting, that means indoor IRS is likely to be inappropriate. It's not going to be that effective. So if IRS works on indoor resting mosquitoes and the mosquitoes are not resting indoors, IRS is not going to be effective. If IRS works on insecticide susceptible mosquitoes and the mosquitoes are resistant to phenyltrethion, the IRS chemical is not going to be effective. So overall, this small little data set demonstrated that 20 years of IRS might not have been that effective, or resistance or behavioral changes might have happened. Since we didn't have any baseline data, we do not understand what happened before that. But at this point in time, we know that IRS is not going to be that effective. And so we communicated this to the Ministry of Health. And of course, there were several things that happened, and policy was changed. This was published, and a key point in this entire endeavor in Panama is Mario Avia. Mario Avia, and that's him right in the middle in the red hat. He was in charge of the vector control program, and he wanted to make a huge difference. And he fought everyone and everything to get these studies approved, to get these studies moved forward, to analyze the data, and to present the data in a really good manner to all the people who made decisions. Mario Avia changed things in his country, not us, he did. And this is so important because one person, one single person fighting against everything can change everything. You're right. I can see all the little clapping signs. He requires more clapping signs. He was fantastic. And what I'm trying to say is that every single one of you are a Mario Avia. You can make a difference. If you apply principles, if you do things that can change things appropriately, you can make a huge difference, just like he did. So the key messages to this is that gaps in protection, understanding them is really important to understanding what you can do and what you cannot do. Evidence-based decisions will reduce transmission. And in this study, an ESPT-based entomological surveillance, what we've been doing for the last 2 days, can absolutely change policy and change things and protect people better. And the key point is that you, just like Mario, can make a difference. That is a short presentation on one example of application of the ESPT, and I hope that went through well. And Leo, at what time do we have our break? Because I do have another example that I
Exactly
can.
now. Exactly now,
Perfect
if
timing.
you don't mind. Yeah.
Oh,
So,
absolutely.
yeah, thank you, Neil. Perfect timing. So, let's break for 5 minutes, please, audience members. Can I just ask? Okay, some of you are having problems seeing Neil's slides. I think Wulan did indicate in the chat box if when Neil is busy presenting, when his slideshow is on, then you will see at the very top of your screen, there's a bar there. On the extreme left, it says Zoom or something like that. But towards the middle, there's a little tab that says Prof. Neil's slides, or Prof. Neil's presentation. Click on that, and you should be able then to see Neil's slides come up. So please remember that. If you don't see the slides, look at that very top bar and click on the tab that says Neil's Slides. Thank you, everyone. See you in 5 minutes' time. Sorry, I'm struggling to get. Oh, okay. Neil, you ready to go?
Yes,
All
I
right.
am ready.
Thank you. Thank you, Neil. Hello,
Hey, everyone.
everyone. I hope everyone was able to do in 5 minutes what you would normally do in the 10-minute break. So let's go straight back to Neil. Thank you for that. Thank you, Neil. Sorry, Neil, can I just
Hey,
say,
everyone. Of course.
here you can see at the top of your bar, have a look right at the top of your screen. On the extreme left, it says Zoom Workplace. Then the next tab is Webinar. And then the next tab is Neil Lobo's screen. Please click on that tab if you're having problems seeing the slides, and hopefully that will resolve your problem. I apologize for interrupting you, Neil.
Oh, not at all. Not at all. Hey, everyone. Welcome back. And this might be my last presentation for today. Another example, and hopefully will capture different aspects of what we are doing. So the example is from Cambodia, where we want to eliminate malaria, of course, like we want to do this everywhere. And part of part of elimination is getting tools and interventions to everyone, even if they don't live in areas that are like a house where you can put in bed nets and IRS. So here in this situation, we want to look at appropriate, acceptable, and effective tools. If you remember the figure of gaps in protection, we want to get tools that fit in those gaps in protection. I noticed in some of the questions that came across where how do we protect people in outdoors, or how do we protect people in forests or in refugee camps? And places where bed nets and IRS do not work that well. And here is where we have to adapt and understand these gaps in protection to try and figure out what fits there. So, how do we get appropriate, acceptable, and effective tools delivered to the right people? And those are the people who get malaria, right? Because sometimes it's not everyone in the community, it's a target specific high risk group. How do we get tools to those people and in the right places? And in this uh, map of Cambodia, the little circle is in the wrong spot, as usual. If you move that little circle slightly to the right and slightly below, you can see that red over there. That's where the circle should be in Mondulkiri. Uh, to the right places. How do we get the right tools to the right people in the right places? And that's sort of the objective here that we should all have. So in Cambodia, perfect. The circle's in the right spot over here. Uh, in Cambodia, the high-risk group of people and most of the remaining transmission is happening in forested areas, in groups of people that go into the forest. These structures in which they live in, you can see this picture, are not traditional structures. So what do we do in these places? What do we do in these times? Uh, it's really interesting because you can't really put up a bed net every night. You can't really spray the walls because you can see there are no walls. What do you do there? That high risk groups of people are people who live in villages and go to the forests. So we have to protect them when they go to the forests. The high risk group of people are forest rangers, like, for example, World Wildlife Fund rangers, because they're walking through the forest doing their patrols, as well as indigenous forest dwelling people who live in the forest. So you remember this, right? Um, your intervention works by overlapping with vector and human behaviors. This figure is so simple, but it's so useful to understand so many things based on your intervention. Now, once you figure out your gap in protection, what we wanted to do was try and see, hey, can we put another intervention into place to reduce those gaps in protection, to further protect people? So, can we put in one, two, three interventions into this area that protect people at different places at different times based on their exposure? Because, for example, bed nets don't protect you everywhere all the time, right? If we have bed nets indoors when people are asleep, what can protect you when you're awake or when you're outside? So, this is what our strategy was. Can we look at interventions that protect people in multiple places at multiple times in this target high risk group of people? So the first thing was to understand what they do. What are people doing? Where are they doing it, right? What are their activities? And then what are mosquitoes doing, right? What are the mosquitoes biting? And what interventions would fit into those spaces and times? And here's a little cartoon of the forested area. So here is what we realized were the three exposure places. The first one was in side structures. They slept in these temporary structures. So that is an area where they were sleeping that we can potentially protect people. The second area was when they finished working or they were waking up, they were cooking and hanging out. A lot of them were drinking. Uh, so that was a second exposure place. And the third exposure place was when they were going to the forest and they were actually working there, picking mushrooms, cutting trees, or whatever they were doing. So we had three exposure places. And we thought, now what interventions can we map to this area? Now, in the temporary structure, we thought, what if we try a passive volatile pyrethroid spatial repellent? Basically, a spatial repellent that's passive. Passive meaning you don't have to use it or spray it or put it on. You just kind of hang it up and leave it there. So we thought, what if we try that out? The second one was a spatial repellent spray. Like it's an active spatial repellent. So you actually have to do something. You have to spray it in the air to have the volatile chemical in the air. The third one was insecticide treated clothing. What if people's clothing was treated with insecticide so mosquitoes that land on them would die? And the fourth one was a topical repellent, like a cream that you put in your hand that was a repellent. These are four things we thought, what if we apply these and see how they work in this area, in the temporary structures? Now, when they were outside the temporary structures and hanging out and eating and doing things, relaxing, what can we try out? And we were like, oh, the passive BPSR, the passive repellent might work there as well. The spatial repellent spray might work there as well. Treated clothing might work. And the topical repellent might work. And when they were out in the forests, we probably could not take the passive VPSR along, but treated clothing and topical repellents might work. Now, one thing we did do was evaluate all this in a really controlled manner. And this is what I'm going to present. So we took these interventions, and here is a picture of them. This is the spatial repellent spray, Fuji, on the right. Autan, some of y'all might know, is a topical repellent that you put in your skin. This is ranger treated uniforms. We treated them with insecticide uh, etofen and you can see this is directly targeting the forest rangers who were a high-risk group. And we also treated civilian clothing with insecticide, etofen because as usual, most people in these villages, in these areas, do not wear long sleeve, long pants. So we wanted both kinds of clothing to evaluate. And of course, we had the passive spatial repellent, and you can see that little sheet hanging up there. It's called bite barrier, and we hung that up in the structures. This is in a semi-field system where we were evaluating it. So this is the forest pack, and these are the products we evaluated. Now, this picture is where we evaluated everything in a controlled manner. In each of these tents, we put in one of those products, and we followed the number of mosquitoes that landed on a person in the tent with the product in there. The little black tent right in the middle that you can see is where I slept with along with the team, with a whole bunch of people on the team. And the data you can see this area is completely open right by the forest. Wind would blow through these tents. Uh, Mosquitoes would fly through them, rain would come through. It was very open. It wasn't like a house, but we were trying to replicate the structures in which these people lived. So the results were crazy positive, and I would not believe it if I was not in the middle tent looking and making sure everything was going okay, even though the person who did all this, Dina Doom, is fantastic, and he was there with us throughout. So this is the results. I will briefly explain this. On the left is the cumulative number of mosquitoes, the total number of mosquitoes we added up every day from the previous day. If we found mosquitoes in one day, we'd add them to the previous day. So you can see 49 days because we had seven kinds
Neil.
of intervention.
Oh, okay.
Yes. Yeah.
Sorry. It's now corrected itself, but there's a lag of multiple seconds you start explaining and you're well into the explanation before the slide actually appears. So I'm just making you aware of
Oh,
that. So I don't know what one can do about that, but just
oh,
be aware that there's a bit of a lag between you starting your explanation and the slide actually appearing, and it's about 5 seconds.
okay.
So just be conscious of that, Neil.
Thank you. I will pay attention. And Leo, please interrupt me and tell me if I'm going too fast. Thank
Th
you.
Thank you.
So on this slide, on the left, you can see the cumulative number of mosquitoes. So on day two, we'd add those mosquitoes to day one. Day three, we'd add those mosquitoes to the previous 2 days, and so on. It was a Latin square design, which is a study type. There were 7 different interventions, and I'll just go through them. We'll go from the bottom up. 124 mosquitoes were in the combined. So if we look at a first pack of everything together, we had the passive spatial repellent plus the active spatial repellent plus treated clothing plus the topical repellent, the cream. Then 138 mosquitoes were in the passive spatial repellent alone. Now, the greens are the civilian clothing treated with etofen-prox. We wanted to see how long it lasted, so we actually took a set of clothing and washed it 20 times. So 0x is fresh clothing and clothing freshly treated with etofen-prox. Then we treated it 20 times. I'm sorry, we washed it 20 times and then we evaluated it. We did the same thing in the blues, which are the ranger uniforms, long sleeve, long pants, freshly treated and washed 20 times. And I know they were washed 20 times because I washed them myself in a bucket. We are trying to replicate naturally what happens. And the control without intervention is right on top. So we had 3,537 mosquitoes in the control. And you can see there was a huge drop in each of these interventions. And together, everything together, there were only 124 mosquitoes, which is about a 95% reduction. And the volatile passive spatial repellent, there were only 138, which means it's just ridiculously effective in this outdoor setting. And just to remind you, that's what it looked like, right? I have to wait 5 seconds for the screen to appear. I hope it appeared by now. But this is the situation, right? Completely open. It wasn't a structure. And we still have this much protection. And so that is why I said if I did not see it for myself, it would have been hard for me to believe. But this is the amount of protection we got with our spray repellent and these other products. And the next step of this project was to try and implement it in an implementation setting in communities. And this is where we see the difference between a controlled study where we can control everything and get these really good results, and an actual implementation study where we have so many lessons to learn. So you don't have to pay too much attention to too much details on this slide, but note that we had data collection. We implemented it at 3 sites, and we had three data collection time points to understand gaps in protection and to understand intervention use. We wanted to see if people were using the intervention and what the continued gaps in protection were. The study was not designed to look at epidemiological effect. And what we found is this is how people were using the intervention. We found is the topical repellent, very few people were using the intervention, only about 8%. And at some sites, only 2% of people were using the topical repellent. So even though the data demonstrate that these can be very useful, in actual fact, people were using it very little. When we looked at treated clothing, etofen-prox treated clothing, in communities, people were using it very little as well. In one village, they just used it less than 1%, so it's not going to be that effective. However, bite barrier, which is the spatial repellent, which is the passive spatial repellent, which you don't do anything, you just hang it up and forget about it, about 100% usage. And that's because you hang it up and forget about it, right? It's so easy to use because you're not even using it. You just put it up and forget about it. So this was a huge learning lesson right? Because we can see how we can translate a useful intervention into actually what happens in targeted communities, right? So we, as a note, we also did human behavior observations, and we looked at the mosquito densities to look at the continued exposure, places where people are continually being exposed to malaria bites. And what we found is, before I go to that slide, I just remembered something. One thing we realized is that the SBC material, the social behavior change material that went along with these product distributions might not have been optimal. As in, we did not convey, we did not educate the people enough about these interventions so that they maximize their use. And on that respect, that is where we did not do a good job. So the next slide, you can see the bite barrier had 100% use because you did not have to think about it, whereas there's really low usage on the other interventions. Now, when we look at gaps in protection, again, do not pay attention too much, but just look at the overall color of the slides. I had to wait 5 seconds. I forgot about that. Overall, you can see at all three time points, most of the exposure was in the red places, right? And what is red? When they were awake without nets, right? And you can see, so even though we had given them interventions, some of them they did not use very well. Some of them were just left up in the houses and were actually in use. Still, we can see where exposure was happening, and that's in the red areas, which is awake without bed nets. And you can also, awake without bed nets outdoors. That's a key point. So most of the exposure was happening outdoors. Uh, and now we can continue on with trying to understand what interventions might work in those places, how to develop better SBC material, social behavior change communication material. So the significance of these results is that we can have a really good study, controlled study that demonstrates 95% reduction in landing with a specific intervention, 95% reduction in landing with a combination of interventions, with a package. But when we go to the field, when we actually go to implementation, there are so many other things we might have to consider. And the key thing here was how people look at the intervention, how they use the intervention. And to be able to understand this, integrating human behavior with entomology is super important to understand where the gaps in protection were. At these sites, we could see that the exposure risk was mostly early in the evening outdoors when people were awake and unprotected. And this was at all the sites, right? And so at these sites, what we needed was bite prevention tools that work outside sleeping hours, right? So this short data collection sets enables us to understand what would actually work in a controlled setting, as well what would actually work, which was slightly different in implementation setting in the communities we wanted to target. Another key point we understood, which I think I failed at, which was a really good lesson, is that the SBCC strategy, the social behavior change communication strategy, the education strategy, was something we have to be far better at. I had to be far better at. And that is where lessons like this tell us how good a job we're doing, and more importantly, how bad a job that I'm doing, right? Because that's where I can improve. And data like this enables us to understand where we need to develop, where we need to go, and my weak points so we can be better moving forward. And I'd like to close my presentation with this slide again. We need to be problem solvers. And this is key to making a better impact, to protecting our communities better. And that is, I think, my last slide. And Leo, do we have more time to go over the slides that I missed, or do you think we should go into the...
Neil, you actually have at least you have about at least 15 minutes, Neil. I'm not sure if that's going to
Oh,
be enough.
perfect.
Yeah.
Yes, it
Yeah.
will be enough.
Plenty. That's
So
good.
everyone, everyone, I'm going to rewind a little bit and go back to a presentation that I skipped, which is how to present data, data visualization. and presenting your data. And hopefully, and as you might be able to see all the mistakes I've made with presenting, and I hope you can point them out as in how I can improve my data set. I will try and do this in 10 to 15 minutes. So data visualization, a key point of what we do is once we collect all this data is communicating it to people who need to see what an awesome job we've done or what a bad job we've done. We've got to be honest. So these three figures here all say the exact same thing. And each of these figures needs to be targeted to the person, the audience we're trying to communicate the information to. Each of these things require different things that go along with it to say when we try to communicate the information. And it's super important to target your graphs, your figures, your slides to people we want to communicate the information to the decision makers, to our bosses, to the funders, to whoever it is. So it's just tips. This slide set is just tips on how to present data effectively. The key point is to know your audience, right? Where are they coming from? What is their job? What they need to get out of your presentation? And we need to change your presentation to their level of expertise, their level of exposure, how much they know about entomology, about entomological surveillance, right? Focus on what they need to know and leave out anything that's not relevant. So many times I will present the same data to different sets of people and completely change my slide sets, even though it's the exact same information. If you take that effort, you will be a much better communicator. A key point is also, what is your goal? Right? Are you just giving them information? Are you trying to convince them to give you funding? That's important, right? Are you comparing data sets? Are you trying to convince them to make a decision? So target your presentation, target your slides, target the information to what you need to communicate, what your goal is, and what they need to hear, and their level of expertise. Right? And an example is, do they understand SOPs, scientific SOPs? Or HLCs. If they don't understand it and if they don't need to know it, do not go over it. It's not needed. The second point is data, right? Your data you present has to be relevant, it has to be accurate, and you have to provide appropriate context. In the cartoon on the right, should I follow the data or my instincts? Please don't follow your instincts, follow the data. And when we're looking at data accuracy, here's an example. Let's say we have 12 months in the year. You can see the figure on the left, month 1 to 12. And in reality, let's say we get five, I'm making this up, of course, five mosquitoes per person in month one, 10 mosquitoes per person in month two, and so on. That is real data. That's actually what's happening in your system. But the data you collected was only in month three and month nine. And you collected, of course, the 15 mosquitoes and the 8 mosquitoes. Now, this is reality, what happened if you graph it out, right? This is what actually is happening. But the data you collected is just those 2 points, right? Now, how do you make this presentation accurate? If I make a graph that is like the green part right now, that's what it's going to look like. And that is completely wrong because it's not the same as the green, right? So you're actually making up the data in between your 2 points, which is not correct. So I would actually do the bar graph. I would present the bar graph, just those 2 time points, and not try to join them because the joining in the orange or the pink or whatever that color is not accurate. So try and make sure that you're actually presenting what data you collected without making up in between. It's so easy to join those two bar graph lines, but that would be wrong. And how to provide context. When you're presenting context, and this is something I'm often at fault with, and I've been trying to correct myself during this presentation, these presentations, is here. Let's say we present this figure, and I put it up. What does it mean? While I'm talking right now, everyone is looking at the figure and maybe not listening to me, and they're trying to understand the figure. And what I should have done is provide context to it so the people looking at the figure don't have to wait for me to explain it. So what is the x-axis? What is the y-axis? Right? A simple title would be nice. right? What is the thing you're trying to say to the figure, say about the figures? Put it all on the figure even before you explain it. So if someone's looking at the figure while you're talking, for example, right there, right? They don't have to wait for you to explain it. Here we explain the x-axis, the y-axis, the title, and you can see just by looking at it exactly what it says and your take-home message. Put that all up. And I've been trying to do it during these presentations, and apologies if I've messed up because I do that a lot too. When you have a figure or a table or anything, try and make it as simple as possible. For example, here is a beautiful, complicated, very accurate depiction of the malaria life cycle. If I am trying to say malaria is transmitted between humans and mosquitoes, and if I use this figure, this might be a little too much. A very, very simple representation of that could be just this figure. I completely made this figure up, right? Anopheles on the left, humans on the right, Plasmodium is transmitted between the two. If you put up the figure on the right, that's just way too much for a person to focus on. If you're trying to teach a lesson on malaria transmission, perhaps this would be accurate or useful. But for a presentation, the one on the left might be slightly better to use. Another point is to use consistent scales. Now, if you have, let's say, monthly mosquito capture rates, where the x-axis you have the months, and on the y-axis we have the numbers of mosquitoes. If you just look at this figure, it looks like we get the same numbers of mosquitoes at site A and site B, right? However, look at the numbers of mosquitoes. On site A, it's 600 on top, and site B, it's 10 times less, it's 60. The scales are completely different. So try and visualize, try and make your visualizations representative of what's actually happening. So if we actually put them together, you can see site A and site B actually has drastically different numbers of mosquitoes, even though the curves, when you separate them, might look the same. So use consistent scales. So now, try and design your slides for readability. If I were trying to explain what I was doing, and if I put this up, people are going to fall asleep. No one's going to be listening to me. They're going to be looking at the data, looking at trying to read that, and that's just far too much to read, right? Uh, less text, the better. Don't do that, please. So you can do the exact same thing on this slide. The exact same thing is represented in this flowchart, right? What interventions do we need to implement in a site with low bed net usage? Let's look at mosquito and human behavior and bed net presence and usage. Where are people being protected? Where are people being bitten? And here are the options of interventions we can use. This is exactly what we described in this. But this is just far easier to look at. We've told a story, there's a flow, and we have key takeaways presented on that slide. So in summary, a short data set. Know your audience. The data should be relevant. Try and simplify what you're presenting. Design it for readability. Like a lot of the times when people are looking at your slides, they're trying to look at your slides and not listening to you as much. So everything on your slide should be simple and easy to understand. And it's really easy, and people are interested when you're telling a story. And I think that's it. I am finished with my slides, and I hope that last presentation was useful. Leo, over to you.
Thank you, Neil. What absolute perfect timing. My goodness.
I
We weren't
tried.
deprived of any of your, presentation materials. So I'm very happy that we were able to fit in everything you had available. So that's wonderful. And Neil, I think from our audience on their behalf, because I absolutely know my comments will reflect the opinion of the audience. I mustn't make that assumption, but I'm making the assumption my assumption is correct. What a privilege to listen to such a top quality presentation, uh, just reflecting so much experience and knowledge and practical field experience This isn't just book learned material. This is honed by experience in the field, personal insights and experience that you've gleaned and put into this ESPT tool, and now being taken up by so many countries across the world. It just speaks so highly of the quality of the thinking that you've put into these training sessions and the ESPT tool, etc. So from all of us, Neil, a very sincere expression of gratitude to our audience. Be assured that everything has been recorded. Wulan has, or Dr. Porn has put into the chat box the URL where you can access it on the Aureen website. I'm hoping maybe Dr. Porn or Wulan can do it again as a refresher, where you can access that URL. Please go back to it to refresh yourself about particular aspects. There's so much, a wealth of wisdom and knowledge there. Please refer your friends to that site so they can benefit from this knowledge as well. So what we're going to do now, sorry, may I also very quickly just also thank Dr. Pon, Dr. Mukhtar, Wulan for your support and help in making this course uh, available. We're going to ask our audience, please, before we go to questions and answers, that's still coming. Very important learning opportunity there in the Q&A session as well. But before we get there, please, if you could spend 15 minutes just answering the post-course survey questionnaire so that we can get an idea of your knowledge after having gone through the course in relation to before the course. So I'm going to allow Wulan opportunity to explain to us how you can really long session to how you can access that. Wulan. Okay, so then we go straight into the 15-minute session of you responding to the questionnaire, after which we will do the Q&A session. Thank you, everyone. Wulan, let me stop talking and you take over, please.
Yeah, thank you so much, Dr. Leo. Can you hear me well?
Yes, very clear. Sorry, I was on mute there for a moment. Thanks, Wulan.
All right, good. So I put the link on the chat box, and for the moment, I stop the access for everyone to put some comments on the chat box so that everyone can see the link. Then I also share the screen so you can scan this QR code to access the post-test evaluation. We will have 15 minutes to complete the quiz. Thank you.
Okay, there seem to be quite a lot of messages popping up that a good number of people have completed the questionnaires. That's very reassuring. Thank you for letting us know. It means that probably a whole bunch more other people, my language use, hey, not so good, have also completed the questionnaires. So if you haven't completed yet, please continue. Don't feel pressured. We'll start with the Q&A session. So please continue with the questionnaires, and when you're done, then you can give full attention to the Q&A. We're going to go on for 20 minutes about in the Q&A session. So thank you all so much for your willingness to spend time providing us with your responses to the questionnaire. It helps us to measure how effective this course is in conveying that knowledge and measuring the uptake of the knowledge that has been conveyed and what difference it makes to the general community out there interested in vector surveillance, vector control, and these issues. So thank you for that. Neil, are you ready and willing to engage in the Q&A session? I know Neil had a problem with, he sent a WhatsApp message to say they've had a power failure in Uganda, in the particular place he's at. So he was busy waiting for the internet link to be reestablished. So I think let's just give Neil a minute or two, see if he can rejoin. In the meantime, those of you that have not been able to finish your questionnaire, gives you a minute or two extra time to do that. Let me just check my WhatsApp here to see if Neil is sending messages. Thank you, Wulan. Wulan is telling us that the system has recorded 687 responses for the post-test,
Oh,
and more results are coming through. So we're extremely grateful for that. Neil, I'm highly grateful that you were able to re-establish connection. That's great. Let's keep fingers crossed that the connection holds. So I explained to our audience members that you had a power failure there. Neil, can I share screen? And then
yes.
we take it from there. There's the share screen button. Oh my goodness. Can you see my screen, Neil?
Just opened up,
All
yes.
right. So Neil, question one from Gideon. Gideon, thank you so much for I mean, you've posed multiple questions and good questions. Thank you for your enthusiasm. We appreciate it. First question from Gideon is, can I ask Prof. Neil to share us his experience that he has about actual human landing catch, real life experience? Between where the two collectors are located in terms of distance, presumably indoors, and then how far should the outdoor collector be located from the house, and whether the house should be closed or in all ways mimic the usual way of life of the community. So ideally, everything about the household should be as close as possible to the norm. And what does the outdoor collector do if there's rain, and how to calculate the human biting rate when such a situation happens, for example, rain. So just your thoughts about these practical issues, Neil. Obviously when it rains, you have to move if you're not under a shelter. But remembering that you want to be in an open environment because you're supposed to be doing outdoor collections, etc. Your thoughts around the practicalities of these human landing catches, please, Neil.
Yeah, thank you, Gideon. A great question. So when doing HLCs, we want, as you mentioned, representative data collection. So we want to select sites where communities might actually be exposed. So the human biting rates we get can be as representative of what's happening in that area where the community is. So you want to pick the sites based on your question and pick representative sites. Now, when it rains, uh, what's really interesting is I thought when it rains, mosquitoes don't bite. And I'm completely wrong. I was in the Solomon Islands once and I was collecting mosquitoes under an umbrella in the pouring rain, and the mosquitoes bit just the same. And recently, there are some really cool videos of how mosquitoes can actually avoid raindrops. If you Google mosquitoes, raindrops, avoiding, and bees actually, they did it a bunch of insects. They can actually completely avoid the raindrops, so it doesn't stop them from feeding. So what we have done in our HLCs is we actually provided the person who's sitting outdoors with a tarpaulin or something to sit under so that when it rains, he doesn't get wet. And the reason is because the data is still there. The mosquitoes are still biting, and we want that data even with the rainfall. So hopefully you can encompass that in your collections, because if you don't do them, you have a gap in your data points. I hope that answered your question.
Yeah, thanks, Neil. And also it shows the value of replication. Don't rely on one night's catches. You need to do as many replicates as you can so that ultimately your sample is representative of the real situation. Thank you, Neil.
Thank
Uh,
you.
Second question from Sergio. To ensure effective surveillance, what criteria should guide the selection of sentinel sites for entomological surveillance in countries where with a lot of epidemiological heterogeneity, such as Mozambique? Just your overall kind of comments on that, please, Neil.
Thank you, Sergio. And we actually did a study to understand this in Mozambique, and we're writing up the publication right now. So a sentinel site, the reason for a sentinel site is to collect data that's representative of a bigger area. So you don't have to collect data from every village. Collecting data, that one sentinel site will represent a larger area, so you can apply all the outcomes from your analysis to the entire area. So a lot of times, sentinel site selection is based on a couple of criteria. The first thing is the amount of malaria. The second thing is your vector types. There is the land, what the land looks like, if it's forested, if it's dry, if it's a desert, all these different aspects. If you look at WHO criteria, they have descriptions. If you look in the ESBT, it actually works your way through how to select a sentinel site based on your question. So all these observations and information and suggestions are already present. And if you look through the ESBT, it's already there. And if you email me, I will send you a presentation specifically on this that you can reference. Thank you.
Thank you, Neil. Thank you, Sergio. A question from Trupti. Sorry if I'm mangling your pronunciation of your name. Are there standardized data collection tools, like even a form that can be used on Kobo Toolbox, for example? That way, we can add data cleaning and data validation rules to ensure data is as clean as possible when received. I think you'll agree, having standardized. Anyway, over to you, Neil.
I hope I understood the question properly. But yes, there are standardized data collection tools and forms that need to be adapted based on how you're collecting the data, whether it's on paper or on a phone or on a laptop or a uh, uh, what are those little things called that you can enter data on? I've forgotten. But on there are multiple data collection ways, and you would want to standardize them. But based on the way you're collecting data, you'd want to adapt what's already available. So there are some things available that you can immediately adapt. and use, but there are some things that are available that you'd want to change and make sure that they fit your needs specifically. Yes, there are data cleaning and data validation rules, as with all data collection. I hope I answered that question properly. And Leo, please correct or add if
No,
you feel the need.
thank you, Neil. Another question from our friend Gideon. So this is a more philosophical, broader, not strictly vector surveillance question, Neil, but important nevertheless. Everywhere in the world, there is a problem of net utilization. Different communities have different attitudes towards using nets. Can you suggest any strategy to increasing net utilization? You've been all over the place, Neil, so give us some of your insights if you don't mind.
Completely correct. In every place, you'd want a different strategy because people are different, right? Over here, the people are, I don't want to say they're the problem, but they are the ones who decide what to do for themselves. Uh, I would suggest looking and investigating the community to understand what they would listen to. How do you educate them to realize that it's their own interest? You can talk to the community leaders. Sometimes religious leaders are really helpful to talk to, and they can suggest things to the community. Who does the community actually listen to? They don't want to listen to some stranger coming from a Ministry of Health or someone external, but they might listen to their mother. They might listen to the local health authority. They might listen to the local priest or the local mullah, right? Religious leaders. So understand the community and where their influences come from, and base your strategy to increase net usage or any intervention usage on what the priorities are for that community. That's what I would do.
Thank you, Neil. Next one is very interesting, and it points to shortfalls of data and interpretation of data and the need to understand the data. It's from Evans. Our team is experiencing an interesting phenomenon where we are getting lots of Anopheles gambiae when doing larval collections around our sentinel sites. But human landing catches, both indoor and outdoor, and also Procopac collections are picking up lots of Anopheles funestus and very little Anopheles gambiae. Any pointers to what could be causing this anomaly? And then there's a second part of the question is how far can vectors travel from their site of emergence? But maybe deal with the first one first. Thanks, Neil.
Yeah. What an interesting situation. And since I don't know anything about my site, I have a whole probably need to be answered first. First of all, when you say Anopheles gambiae, there are multiple species in that complex. Is it Gambiae SS or is it Quadriangulatus, who does not necessarily like to bite humans? And the main point here is you mentioned any pointers to why this could be, what could be causing this anomaly. And my first thing is, this is not an anomaly. This is the data you are collecting. This is, if you are doing a good job with the data collection, this is the data that is reflected in your collection methods and what you are doing. It's not an anomaly. What you need to understand is why this doesn't fit with what we conventionally think. So it might not be Anopheles gambiae, it might be Anopheles quadriangulatus, or a species that doesn't bite humans. Your collection method you are using might not be targeting the species of interest. You're doing HLCs. We know that Anopheles funestus loves biting humans, and therefore you're catching it, right? We know that Anopheles funestus is really hard to catch in larval collections. Maybe that's why you're not catching them, because they actually hide in a way that you can't catch them in larval collections. And with the larval collections with Gambiae is pretty easy to collect with larval collections, but is it Gambiae SS? Is it Arabiensis? Are you doing your molecular methods to understand exactly what species are? And your Anopheles gambiae also might have changed its behavior to not feed on humans and prefer feeding on cows because of interventions in place. There are all these things that might have happened. So I have more questions than you've asked me. And so sort of looking at the data you have and trying to understand it by asking more questions will help you hopefully understand what's actually happening. And about how far can vectors travel from their site of emergence, data demonstrates that it can actually be, and the data was based on Anopheles gambiae and a long time ago. We don't have any recent data, and we don't have much data on other species. It's about 1.5 to 2 kilometers. In one night. But then, if you think about it from a realistic general perspective, if a mosquito can fly like 1.5 to 2 kilometers to get a blood meal in one night, how far can it fly in a week, right? And all they prefer to just find their food close by, just like me. So if they don't have to answer your question,
Thank you, Neil.
I
Good response.
guess it keeps to ask. Yeah, thank you.
Neil,
Yeah.
we're losing you.
Yes.
You're breaking up.
Oh, sorry.
But okay, we do what we can under the circumstances. Richard has a question. Can IRS and LLIN interventions be done in parallel sentinel sites to weigh out to understand which intervention is more effective? Better wrap your mind around the question a bit.
And I think the studies based on this site have demonstrated that IRS can increase efficacy a little bit over bednet. If you design a study well enough, you can try and understand how they function against your mosquito behaviors. Evaluation, you don't actually have to implement the interventions to evaluate them. The implementation, the potential of IRS together at your sites, even before.
Neil, can you hear me?
I think he's trying.
Yeah. So apologies for this audience. Let's just give Neil a moment. It points to how fortunate we've been that at least for the bulk of the 99% of the course, the power in that part of Uganda did hold. So very happy that that was the case. But it's giving in right here at the end. I wonder if there's a thunderstorm going on outside where he is, maybe something like that. Let's give him a minute. Uh, Dr. Mukhtar, are you still with us, Dr. Mukhtar?
Yes, Dr. Liu, I'm there.
Okay. So,
Yeah.
Dr. Mukhtar, given that we have this lapse where Neil is not available right now, and I'm not sure if we're going to get him back. Maybe this is maybe it's going to continue for the next 15, 20 minutes, 30 minutes. So I wonder if I could ask you to give our audience members a kind of a final word from your side on behalf of the APMEN Vector Control Working Group, so that we fill this period of silence. And while we still have our members listening in, because people are probably going to start dropping off very soon. If you don't mind, Dr. Mukhtar.
Thank you. Dear esteemed colleagues, good afternoon, good evening, and even good morning in some, some region as well. It has been a true honor for the APMEN Vector Control Working Group to host this important virtual meeting on vector surveillance, which is a crucial pillar for the ongoing battle against malaria and other vector-borne diseases. And Dr. Liu Devan mentioned that amazingly, we have more than 2,500 registration and more than 1,000 actual participation, which really shows your trust on the APMEN Vector Control Working Group and the knowledge which are being shared by this prestigious forum. The discussion over the 3 days have reinforced the shared common goal we have to enhance our understanding and capacities in monitoring the disease transmission vector, which remain the persistent global public health challenge around the globe. The insight presented over 3 days on the new tools, methodologies, and data-driven strategies are not only timely, but essential for achieving the effective and sustainable surveillance system. We extend our deepest gratitude to our distinguished resource person, Professor Dr. Neil Lobo, for his invaluable contribution, for delivering an outstanding presentation that combine the deep technical expertise with the real-world applicability, enriching our collective knowledge and the insight. Meaningful actor for the generously sharing his time, insight, and the expert and experience, which have been instrumental in evaluating the quality and impact of the today's and our last 3 days session. And I'm very happy to read one comments from one participant that thanks God for giving a Professor Neil to the word of entomologists. Definitely, it's a crown for the Professor Dr. Neil for such his outstanding capacity for delivering a very valuable knowledge to young entomologists around the globe. At the end, thank you once again to all participants, particularly and organizers, Dr. Liu, Dr. Pon, Volan, and esteemed speaker, Dr. Uh, and together we'll let us continue to work towards stronger surveillance system and a healthier malaria-free future. So thank you very much, all of you, for your outstanding actively participation, for giving us a very big boost for future similar courses for young entomologists to achieve our common goal of malaria and other vector-borne disease elimination globally. Thank you very much.
Dr. Mukhtar, I can only echo what you say there. Very appropriate words, and thank you for that. And thank you as well, Dr. Mukhtar, for joining us. I can only say to our audience members that we will try and get Neil to repeat this course again next year, and also do another course on data management next year. Multiple day course on data collection, data management, data dissemination, development of data forms, etc. So we have that to look forward to next year as well. And there will be other APMEN courses as well. We're continually exploring development of new courses. Of course, we have to find funders to help us pay for these kinds of things. But be assured that we will continue with these and, of course, our webinars and so on. So to all of you, thank you for your patience and and interest in joining this course. We wish you well. The system will send out tomorrow in 24 hours time a course satisfaction survey, very short. I think it's about 5 questions. And again, it's a tick box kind of thing to assess how satisfactory you found this course. Again, it just helps us to understand where we can improve and so on. So thank you to our audience members. Thank you to Neil. Thank you to Wulan, Dr. Pon, and Dr. Mukhtar. Thank you all. Have a great day. See you next course. Bye-bye now.